Hey everyone, welcome back to my channel. So today we are learning about 10 symptoms of male breast cancer. Although it is more typically linked to women, men can also get breast cancer, but this is less common. Male breast tissue does not go through the same intricate developmental stages as female breast tissue, which explains why the incidence is lower in men. While some milk ducts are present in men, they are not as developed as those in women. Prevention is key, as it is with any health issue. An early diagnosis might result in a better prognosis. 1. Inverted or retracted nipples. An inverted nipple may be a possible outward indicator of male breast cancer. This merely indicates that the nipple retreats inside the breast tissue rather than protruding outward. Though it affects women more frequently, men can also be impacted by this ailment. A massage of the surrounding area may cause the nipple to momentarily protrude. Depending on how severe the disease is, inverted nipples can have different degrees of severity. It is imperative for public health journalists to increase awareness of these symptoms in order to facilitate early detection and treatment of male breast cancer. 2. Persistent fatigue. Exhaustion is one of the first signs of male breast cancer, and it's also a common signal of many other chronic illnesses. Most of the time, resting will help ease fatigue. For cancer patients, however, things can be different because even prolonged rest intervals might not be able to lessen exhaustion. Your body uses fatigue as a natural warning sign when anything is wrong, so it's especially alarming if it lasts for an extended period of time. Your body runs out of resources trying to fight cancer as it advances. It is imperative that you see your doctor for additional assessment if you discover that your tiredness does not go away when you rest. 3. Changes in breast size and shape. One typical and frequent symptom of male breast cancer is a change in the size or form of the breast. Unfortunately, because they frequently feel embarrassed by these changes, a lot of guys choose not to seek help at this point. This unwillingness to seek medical attention might impede diagnosis and possibly make the prognosis worse. It's important to keep in mind that early detection is critical, especially when it comes to cancer. Keep an eye out for any changes in the breast's color, shape, or texture, since these could all point to a potential problem. Don't let fear or shame prevent you from consulting a doctor if you discover any unusual changes. 4. Abnormal nipple discharge. A less frequent but important indicator of male breast cancer that can appear when the disease is aggressive is breast discharge. Although most instances have a palpable mass, nipple discharge should not be disregarded as it may lead to a delayed diagnosis, which may worsen the prognosis. Notify your doctor right away if you see any discharge coming from your nipples, taking note of its color and consistency. It's also important to keep an eye out for any associated symptoms, like redness or a rash, that could accompany nipple discharge. 5. Unexplained weight loss. For some people, losing a certain amount of weight can be advantageous, especially if they are overweight. On the other hand, weight loss that seems inexplicable may be a sign of male breast cancer. This is due to the fact that the illness causes the body to expend a large amount of energy, which leads to weight and mass loss. Cancer may also result in decreased appetite, which can lower food consumption and eventually cause more weight loss. Keeping an eye on your weight and making sure it stays within a healthy range is crucial. It is imperative to speak with your physician if you see weight loss without making any dietary or exercise adjustments. 6. Presence of a breast lump. The appearance of a lump in the chest or nearby areas is one of the most obvious indicators of male breast cancer. While women are most affected by breast cancer, it's important to keep in mind that men might also receive a diagnosis for this kind of illness. Therefore, it's critical to maintain a watchful eye out for any odd changes in the chest region, since lumps are frequently among the first signs to appear. Gently palpate the breast tissue to perform a self-examination. Feel for any unusual lumps or bumps. Do not hesitate to get in touch with your doctor right away if you notice anything unusual. 7. Additional symptoms to watch for. Male breast cancer can show with a range of less common indicators that may suggest the disease's growth, in addition to the standard symptoms of pain, exhaustion, and weight loss. These symptoms may develop gradually over time or occasionally manifest abruptly. Unexpected bleeding from the nipple, which may or may not be followed by discharge, is one particularly odd symptom. It's imperative to maintain vigilance for any questionable bodily changes, like enlargement in the chest and its surrounding regions. My mission as a public health journalist is to make readers aware of these less common symptoms so they may take the appropriate action to keep an eye on their health and seek medical assistance when necessary. 8. Lumps located beneath the nipple. A lump under the nipple can occasionally develop, and this is a serious indicator of male breast cancer. A tumor may be benign, which means it doesn't spread, or malignant, which indicates that it has the potential to spread to other parts of the body. Given the rapid progression of cancerous tumors, it is imperative to listen to your body. To stay in good health, doctors advise performing a self-examination of the torso every few weeks. Consult your physician for advice if you're unsure about how to implement a self-care regimen at home. 9. Skin redness and irritation. Redness or irritation of the skin, especially in the vicinity of the nipple, is another probable indicator of male breast cancer. There are several areas of the breast where this symptom may appear. While there are usually accompanying symptoms associated with cancer, in many cases redness may be the only apparent sign. It is imperative that you see your doctor for additional testing if you see any redness or inflammation on your skin. A rash may appear on the affected skin and may stay there or come and go. It's also possible for the skin to feel warm and sensitive to the touch, which means that you should be particularly aware of any changes in the texture and appearance of your breast skin. 10. Unusual rashes. In addition to being a common reaction to irritants like allergies, skin rashes can also be an indication of more serious illnesses like cancer. Men who have breast cancer may get a rash in the affected area in addition to skin cancer. This rash is usually red in appearance and occasionally may have a scaly texture. Inflammation is another way it may manifest. It's critical to distinguish this kind of rash from similar-looking skin disorders like psoriasis. It's critical for public health journalists to spread the word about these possible symptoms in order to promote early diagnosis and treatment. The outlook for breast cancer in men varies depending on how far it has spread by the time it's diagnosed. It may be possible to cure breast cancer if it's found early. A cure is much less likely if the cancer is found after it has spread beyond the breast. In these cases, treatment can relieve your symptoms and help you live longer. Speak to your breast care nurse if you'd like to know more about the outlook for your cancer. If you find this video helpful, give it a thumbs up and share it with your loved ones. Subscribe and comment below. For more videos like this, hit the subscribe button and turn on the notification bell. Thank you for watching.